Good afternoon, and welcome to the City of Palm Coast Virtual Town Hall. It is May 13th, 2020. I would first like to welcome our guests at our virtual City Hall that has been closed due to COVID-19. So we're very grateful to be able to host this venue to provide updated, accurate information by our subject matter experts that have continued to help drive decisions for us as a community in the best interest of all of our residents. So I'd like to continue to welcome our Palm Coast Fire Chief, Chief Jerry Forte.
Good afternoon, Mayor.
Thank you. Welcome.
Thank you.
Bob Snyder is our health officer for the Flagler County Health Department. Welcome.
Good to be with you, Mayor.
Thank you. Our city manager, Matt Morton.
Good afternoon.
And we are equally and pleasantly grateful for our virtual call-ins today. Joined by phone, we have Dr. Stephen Bickle, who is our medical director for the Flagler County Health Department. Good afternoon, Dr. Bickle.
Good afternoon.
Thank you. We're also joined by a local headquartered company, our CEO, Tony Hoffman of Diagnostic Solution Labs. Welcome, Tony.
Good afternoon.
And we're also joined by Dr. Vincent DiGennaro, who's going to provide a very thorough update on antibody testing. Unfortunately, we're not able to have our COO, Wally DeQuino from Advent Health Palm Coast, who was called away to an emergency, but we will be responding to the answers relevant to Advent Health later on in writing that will be posted on our virtual town hall page. And so what I'm going to do is start off with just an opening sort of update just about some of our subject matter experts that are with us today, and then we will go into the question and answer phase, which our residents have submitted and continue to submit really important questions for our subject matter experts to respond to. So we continue to be very thankful for our residents' participation and wanting to be really informed on this matter. So I will first look to Bob as an update for the Health Department.
Thank you, Mayor. Just want to give you a brief update on what the three priorities are, everyone, for the Department of Health statewide, and in turn for all 67 health departments, including ours. Number one priority is testing. We've been challenged by the State Surgeon General, Dr. Scott Rifkes, who also is the Secretary of Health for the state, to have each county test by the end of May 2% of your county's population. So using 108,000 people as the base, the DOH said you need to be testing at least 2,170 of your folks in Flagler, and I'm happy to report that as of May the 11th, we have tested 2,404 folks. So we have surpassed that 2% goal, and we're going to continue to test throughout the month of June. So for the last 5 weeks, Mayor, we have been testing at the Daytona State College Palm Coast campus due to the efforts of many partners, law enforcement, Flagler County Volunteer Services, the Department of Health, City of Palm Coast, Daytona State College, Emergency Management, our EMS paramedics, our hospital. We've been all come together, a group of 30 people, have been testing now for 5 weeks. For the last 3 weeks, the Advent Health Lab has been the workhorse lab for this effort, and boy, their volume was just overwhelming. So we're going to start a new phase of testing next Monday, where the Department of Health contracted lab called Northwest Labs will be the lab used, and contractually they have a deliverable of giving us test results within 3 to 4 days. Many people have asked questions about, I haven't gotten my test results from the Advent Health Lab. testing operation the last couple of weeks, and that is simply because the overwhelming amount of volume has been identified and surfaced for this lab in Texas. So they're trying their best to get those lab results out, because we're waiting for them ourselves at the Department of Health. So testing is going to continue through the month of June at the Daytona State site. And also testing is happening at the health department, at urgent care centers, at ASA, Federally Qualified Health Center on the Parkway. So there's a lot of places in town where you can get tested. The next priority is contract tracing and tracking, which we've talked about. This is where our disease investigators identify the infected individuals, and we interview them and identify their prolonged close contacts to make sure that they're doing the right thing with respect to isolation, quarantining, and knowing what signs and symptoms to look for. And then the third priority is providing support and help to all of our long-term care facilities and nursing homes. And our health department, along with nursing strike teams from around the country, have fanned out the last 3 weeks, and we have done face-to-face assessments with every single one of our 71 facilities here in the county to make sure that the best practice infection control protocols are being adhered to, make sure they have PPE, and offer free testing for all their residents and staff. So last week, Flagler Health and Rehab and Main Street Memory Care Center on the Parkway, all their residents and staff were tested. We're testing 2 more facilities Friday and 2 more next week, but I'm happy to report that not one person was found to be positive with COVID-19 in the 2 nursing homes that we tested last week. So we regard that as good news, and we'll leave it right there because a lot of testing questions, so we'll answer those more in detail later on.
Thank you so much for that in-depth report and update. And it's important to denote that, the Department of Health is really the lead agency for the response of COVID-19. And that is due in part to the fact that, the state has set up protocols and policies that when an incident occurs in any community, that there are appropriate lead agencies that will be leading the response. And so the Department of Health has been the lead agency due to the nature that it is a pandemic, and your agency is responsible for a lot of that within your day-to-day role. So we're going to keep down the line of testing, and I'd like to ask our 2 speakers that are on the phone today to really just give an overall sense of testing as far as where we are, not only in the state of Florida, but really just around the country. What are they seeing? What are some of the trends? We hear a lot about testing. Our residents want to be informed. They want to understand the dynamic that's happening. And so I'm first going to ask our local CEO, Tony Hoffman. Tony, I know you do a lot of contracts around the country in regards to testing, not only with hospitals, but with other government agencies. What are you seeing out there as far as testing goes? I know there's been a lot of dialogue if there is enough testing, if we're doing enough testing, what are some of the constraints in accelerating the testing, and again, on the back end of getting the results and the response of getting those results. So Tony, can you provide that update to us?
Yeah, sure. Happy to. So overall, we work predominantly with hospitals. We're under contract with hospitals in multiple states, and in the hospital settings in the states that we work in, we have seen a decline in the numbers of tests coming in as the peak has been reached, and we're coming down the downslope side of it. So from our laboratory experience, we're seeing a decline in samples from hospitals, meaning that they've not only have less patients admitting with positive samples. And part of the testing, and let me just clarify this, part of the volume of testing we get from hospitals is when they have identified a positive COVID-19 patient, that patient is in isolation. And from there, the protocol is as they recover, every 3 days they would run a sample. If it's still positive, they wait 3 more days. After that, as soon as they get a negative, they would repeat 24 hours later for another negative to then remove them from isolation and release, or get out of quarantine. So there was a really high volume of testing from the hospitals, and some of that volume is multiple tests on a single patient. So it's a little different than what's happening in a community setting. So all the positive patients get retested multiple times, on average like 5 times. So that volume has really come down dramatically, which really speaks to, in our view, the coming over the peak and coming down. Now we've increased testing for, as things open up, like pre-surgical testing. So now a lot of the hospitals in Florida and Georgia are opening up for other surgeries and other services at the hospitals. So now we're doing a lot more samples on patients prior to being admitted to the hospital for surgery. So there's been quite a shift, which I think is great for all of us to understand, that there's quite a shift. Even though the numbers of tests from the hospitals may still be up, it's not on patients being admitted for COVID-19 type symptoms, at least in Georgia and Florida. Up north, still, depending on where you're at, they still have some patient populations coming in for COVID, for sure. And certainly they all do still in Georgia and Florida. But I think that's interesting information that viewers and people listening in would like to understand, that there's been quite a shift in the sample types coming through. So now we're taking on some more testing, also for the state of Georgia. I know here in Palm Coast, we did not run all the samples going through the drive-through, as we don't accept saliva samples, which is a great sample to make ease of use for collecting samples, but we're not validated for saliva. We only receive swabs. So we're still doing those for Palm Coast and for Flagler County at volumes we were previously, but not all of the samples coming through are actually sent to Diagnostic Solutions Lab. But that's the trend we're seeing, and I think that's a great trend.
That's very helpful, actually. Just learned something new. I wasn't aware sort of the continual testing with positive patients in the hospital system. Thank you for that update. That's very helpful. So Dr. Vincent DeGennaro, welcome today to our virtual town hall. We get a lot of questions surrounding antibody testing, a lot. So if you can just, I know you're based in Florida. Last time we spoke, you were up in New York. If you can give just a generalized update on antibody testing, where we are in the country, where we hope to be, what your role is, and where you see us moving forward.
Hey y'all, this is Dr. Vince DeGennaro. I'm down here back in Miami, back in the sunshine. The antibody tests are going to be very important for us to get back to work, get back to school, and to prevent loss of life. I think we need to have a combination of the PCR test, the antigen test, which is a test that tests for pieces of the virus that's different from the swab test. And then we need to have the antibody test. And each one of those is going to have its strengths and weaknesses, and kind of when we should use them is going to vary. And so I think it's important, as we're hearing media talk about this test is the savior or this test is junk, that we keep an open mind that the tests are the tests. We can't blame the tool. It's all about how you use that tool. So if you reference the Abbott ID Now, so that little bread maker Abbott that we kind of heard a lot about 2 or 3 weeks ago, was the next savior, right? And now we know that it has about a 15% false negative rate, meaning that the people get tested, they're negative on the machine, but they're actually positive, 15 out of 100 people, right? So it's not insignificant. And then kind of the antibody tests were the savior, and then they were junk, and now we're back to being on the playing field again. So I think antibody tests, where I see them being used, is first as this testing to see who has antibodies for having past infection. It's probably not as important in a place like Flagler County than it is in, say, New York City, where we know something like 1 in 5 people had it. It may be more important in Flagler County as we go on, by December or January, to know how many people have had it. That'll be a different story. The other, and of course, those people would have some sort of immunity without question. How long that immunity lasts, we don't know, but likely on the order of 9 to 18 months, somewhere in that range. And then the second thing that we would do, that we use them for, is for asymptomatic screening. It means to test people who have no symptoms and test them en masse. So we go to a workplace, we go to a nursing home, we test everybody there. We go to a school and test everybody there. Not suggesting necessarily the little kids, but middle schoolers and high schoolers who can have their finger pricked reasonably. By testing everybody, we're going to catch a lot of people who have no symptoms. And we know that at least half of the people have no symptoms, and we know that they are spreading at least half of the disease. So the ranges are somewhere in 40 to 80%. But at any rate, we know they're spreading a lot of disease, and we're not going to have any chance at defeating or containing this disease while people are walking around with no symptoms spreading it. Things like masks and hand washing and social distancing are all going to make a difference for sure. And we can minimize and decrease those numbers from the past by doing those things. But the antibody tests really are going to be key because we can do them anywhere, because they're just a little prick of the finger. 10 minutes, you get some results. They're cheap, they're easy, they can be done outside a lab. And so that's, but they do lose something in sensitivity. They're not as sensitive as the swab tests. For the virus. And so, the first week someone's sick, you're only going to catch about half the people. So, that's glass half empty, half full. If we're catching only half of the people with it, well, that's 50% of people we wouldn't have caught otherwise, right? Because those people weren't going to get tested anyway because they had no symptoms. If you have a fever and a cough, we stick with this swab test for sure. And then the other people who were negative with the antibody test, well, here, and we're hoping that, if we do a test again in a week or two, then we're going to catch more of those, and or we'll catch them when we know they're immune, which not only helps us for those individuals, but also helps us kind of as a community to know how many people are immune. So it's not just one magic bullet, and it's not going to be just one test. I think everyone should expect to be tested 3, 4, 5 times themselves over the next 12 months. And I see the antibody test as a way to bring that to the public in places like movie theaters or baseball games or schools or nursing homes in a way that we can't do it without where we don't have a lab.
That's fantastic. Thank you so much. Everyone here in City Hall is taking feverish notes on your update, as this is all important information for us to understand as we move forward. And speaking of
If I could I add
please.
a little to that? Because
Yes.
this is Tony. So we also do antibody test. We don't do the finger prick test. We do the blood draw test, and just more information, just so people can add to their knowledge base. In screening large populations, which most of what we have done has been for businesses who are getting antibody testing done for staff. As Dr. DeGennaro mentioned, you do find people who are currently in active disease by doing so. And what we've seen with a limited sample set, but a sample set that's still in the thousands, is almost 2% of the population. We're finding the IgM antibody, which is closer to infection. So it's a small number, but it is, as Dr. DeGennaro mentioned, a way to also find asymptomatic persons. And that does happen and does occur. So I think it is important, too, to make sure that as we're doing an IgM and IgG screen, because those two antibodies come on at different times post infection or exposure.
That's great, Tony. Thank you so much. And since we have Dr. Bickle on as well, and he is again, our medical director here has a wealth of knowledge and has really been reading up a lot on everything that's going on, all COVID. So Dr. Bickle, did you have anything to add as far as both the testing, the antibody testing, where we're at, where you see this trending, and just add on an additional thought by the speakers already?
Yeah, sure. A couple thoughts. Can you hear me?
Yes.
Okay. Question first for Tony. Have you seen any trends emerging yet since Georgia started opening up?
No, the testing volume is still coming down. We work with 7 hospitals in Georgia and 2 additional labs that we received some samples from, who are also working with hospitals just for overflow. And the trend has been down in the numbers of samples coming in and the positive rate for those samples. So there's a pretty good decline. Now, I would say, though, that in Georgia, they've recently just started opening up, so it may take a week or 2 before you start getting persons who become symptomatic and seek professional help, right? So I would think by next week we'll have a good understanding of whether or not it's impacted at least the hospitals we're working with, which are outside of the metro Atlanta area. Just to be clear, but we'll know that probably in another week if we start to see a trend in positive rate.
Okay, thank you. And then the second follow-up question, do you have any rough estimate on the sensitivity of the saliva test, compared to the nasal swab?
We've been looking for good information on that. I will say this, it really depends. It's twofold. Number one, how sensitive is the assay that's receiving and running the saliva? If a patient is pretty symptomatic, you have a better chance of picking that up in saliva than if a patient is asymptomatic. And I say that because the viral load in asymptomatic patients drops at a much faster rate over time than in a symptomatic patient. So if you were exposed and had a viral titer at its peak 5 days ago, and today, 5 days from that peak, you've lost at least 40% of your viral load if you're asymptomatic. Symptomatic patients varies a little bit more, but we think that they stay higher viral titer for a little bit longer than that. So sample types make a difference. The best sample would be getting something directly from the lungs, a lower respiratory, but as that's not really feasible and possible, then there's kind of an order here, and it all changes over the course of time too. So it's compounded by where you're at in your disease process as to which samples are the most appropriate. But overall, nasopharyngeal and nasopharyngeal swabs seem to be, the best, and then oral pharyngeal, that's the back of the throat area, nasal swabs, and then saliva. But again, it really depends on the test, the laboratory running the test. If they have a much more sensitive test who can pick up smaller viral loads, then that can be absolutely a good one. As Dr. DeGennaro mentioned, just as with the Abbott ID Now test, Abbott also makes a kit for laboratories, which is really, really good kit. But the ID Now is a rapid test on site. That the reason why there's a 15% false negative is because there's no PCR process, which actually makes copies of the virus genome, which makes it easier to find and test. That's really why that rapid test doesn't work very well on swabs, is literally there's no PCR involved, which helps dramatically. So I hope I answered the question there. They can all be used. They're appropriate. They're good. The saliva is good for screening. We just don't happen to be validated to run the saliva within our laboratory, so we don't accept that sample type.
Okay.
Oh, no, thank you. You did answer. And I have one more question for both of you, actually. A lot of attention has been directed to the specificity of the antibody testing, which, as you both know, is really important when the prevalence of the past infections in the community is low. And I've heard some encouraging news on that. Could you guys comment on that, where we're at with the specificities of the test?
Yeah, this is Vince. I'll start if I might. It really does matter, and it's probably more important than the sensitivity, because we know we're going to get false negatives, and so we can kind of put in place plans to guard against that. False positives really are damaging in a lot of different ways, and mostly because they're so low in a lot of the tests, but they're not zero. So our test, the COVID Rapid, is zero, and it's been zero in 3 different studies. And I think that really has to be the gold standard. The Roche and a couple of the other kind of desktop antibody tests also have 0 false positives. So I really think in implementing that has to be a goal, is a high specificity, because with such a low prevalence, so few people having the disease, you could actually find a situation where you test people and you find more false positives than you find actual cases. And so that could be problematic for a whole host of reasons.
Well, let me, Tony, did you have any more thoughts on that?
No, I would concur. That is absolutely correct, that you need it maybe more so than sensitivity is the specificity, which, contributes to whether or not you have the false results. So the higher specificity is much more important. And luckily for a lot of the assays, you can actually look them up on the FDA's website and understand a little bit about it. It's a complex topic, but ultimately, the higher the specificity, the better the result is reliable.
And let me just sort of confirm that or support that, is that a lot of the initial I was reading was that the specificities were coming in the 97% range, which is really a problem if the community only has 1 or 2% rate. But if they're even close to 100, in the 90.5 plus range, I just want to support the fact that is a big game changer in terms of the usefulness of the test, not only for population estimates, but also for use in an individual in terms of their confidence level that they really have true antibody positivity and then would be expected to be immune. So that's a big important development.
Thank you all for that conversation. I think we're going to move into a couple of the different specific questions that I think are important, and certainly, we will encourage everyone on the call as well to feel free to comment. But I'll pose the question first and foremost, because we are now in our reopening phase. When the governor had instituted the original order to shut everything down, we complied with the executive order of the governor, and we've asked our residents to certainly take that seriously, and they did, and we're very grateful for that. Likewise, with the reopening, the governor's task force had adopted a phased approach in which our local emergency response team had been consistent with that approach. And so when you see these openings happening, first with the restaurants, now we have with the salons, and then other surgeries happening again, those sorts of things, we really, I think, are in a phase now where we have to have that dialogue, and a lot of these questions that are being posed, there's several that came in around wearing masks, and the importance and significance of wearing masks. So I'd ask our fire chief to first sort of just give an update on where we are with, our phased approach. Now that the governor has recommended the opening up, we've recommended opening up of our trails and open space parks, and made an announcement for May 18th for other recreational facilities. I'll ask our city manager at one point to comment on that and that decision as well. But first and foremost, Chief, if you will, just give a dialogue about the reopening, and then I really just want to dive into the mask conversation, because I think it's a critical component to help continue drive these numbers down at a rate that we can, truly feel comfortable about the safety and wellness of our community.
Thank you, Mayor. The idea of where we are with opening is mirroring the national task force to open up the country, as well as what Governor DeSantis is recommending for opening up the state. And although the opening of the state is slower than what the task force for the national is looking at, I think we really understand and appreciate the governor's approach when he decided to open it up in segments. So opening up phase one on the national level opens up a lot of things to up to 50% occupation in some places, as well as opening up a lot more facilities. The governor's approach, and it's a wise approach, is it's a segmented approach to phase one. So you can call it either phase 1A or first part of phase one, where now you're able to open up small locations where restaurants are at 25%, and after 2 weeks you can assess to see if there's a rise in the numbers of positive cases. At the end of the 2-week period, he opened up the barbershop salons, nail salons, and in 2 weeks from now, we'll see if there's a change in the positive cases from those. So in a microcosm, you can see how the growth in the positive cases would occur after the openings of each one of these. By the time we get to the close of phase one, before we get into phase two, there's criteria we would have to meet. And as Bob said a few weeks ago, it has to be a steady decline. And if we start to see a resurgence in the positive cases, they fall back to the previous case. So when the phase that we're in right now is 25% of restaurants, it's a good assessment. We'll be able to see where we are and the practices that have to be put into place for people to serve people food, the cleanliness that has to take place between people that leave the table that go to the next person that comes in, has to be a waiting period and sanitize the table. All these steps have to take place, and it takes monitoring and an understanding of the people that are doing these new actions. The phased approach, I think, is working very well, and we're seeing the positive actions turn into not as many cases of COVID. As far as the fire department and the city is concerned, we're looking seriously at how we're opening up our facilities to making sure that we have PPE. We've got practices in place, and I can give you an example. Last week we had our own scare in the fire department where one of our members tested positive. 2 of the members in the department that work with them were out on leave with them, so that we made sure that they were away from the department. And it was scary, and our plan of action was immediate. The moment we received notification, the building was sanitized with aeroclaves. Everything was wiped down. We have a spray unit that will spray all the insides and outside of the vehicles. These are the things that we are now having to do when we start to open things. So when we start to see a rise in COVID cases, it causes concern on the first responder that the more cases we see, the more likelihood that we're going to go and have a rise in our department. Fortunately, in the last week, all 3 cases turned out to be negative. They'll be returning to work soon enough, and that's a relief. But it was just enough that the plans that we have in place were put in institution. As far as face masks, I had some time to think about this question, and I wrote some information down. The CDC, the Department of Health, our local emergency manager, and the city recommends everyone to wear face cloth coverings out in public, especially in settings where social distancing is difficult. The supermarkets, pharmacies, and things like that. This is especially true in cases where you're seeing a rise or a spike in COVID cases. Fortunately, according to what Bob's information was today, we're seeing a decrease in the amount of COVID cases, which is a great thing. Although we're seeing a decrease, it doesn't give us the ability to ease back on our diligence and making sure that we're not doing what we're supposed to. We are still recommending the face mask. These recommendations are for people to follow as guidelines to protect fellow citizens from catching whatever the other people have. So if I have a illness and I'm walking through a store, if I don't have a face mask, sputum and other air particles are going to cause other people to catch whatever it is. The reality of the situation is this: people will do what they want, and everybody believes to a certain urgency what this COVID virus is. So if there's a young individual who's healthy and they feel they don't want to wear a mask, We are not going to force them to make a mask. There's no way we can do that. The actions of those not wearing the mask may be of little consequence to themselves, but the vulnerable population in the city, it's a very big deal. So there's alternatives as shoppers and patrons. Those who are most vulnerable, and we're talking about those over 65, and those who have an underlying medical condition, have the ability to go to the proprietor of the store or the store manager and urge them to change their culture and their behavior, allowing people to come in with a mask on. If we can't push it from a legislative point of view, certainly the people that are going to these stores can urge these changes at the shopper's level. Those who are most vulnerable still have the ability to get an N95 mask. And for anybody who's in the medical field, this is our lifeline for initial contact out in the field. We rely on these types of masks to eliminate any type of virus to come in up to 0.003% of the time. But it's important to note that these masks have to fit properly. You see these pictures of folks that are not wearing the mask appropriately, or they're ill-fitting, or they don't fit under the chin, or they don't cover the nose, and they touch their face a lot with the N95 mask. That reduces the strength of the mask and increases the possibility of those folks getting the illness. So I would encourage people, if they are concerned about the mask not being worn, to protect themselves and not ask other people to wear protection for their sake.
So I would ask, I know the health department has a strong opinion on this, and again, really the ones that are asked to understand the data and the science behind the spread and what we've done to mitigate the spread in our community. Masks has now been a significant part of that dialogue as we move to reopening, and how that impacts those numbers. And so, Bob, Dr. Bickle, I would certainly pivot to both of you for a response on the mask dialogue, and then I would also ask, again, anyone on the call themselves to please provide their thoughts as we're all, trying to determine and advise these safety precautions for the most vulnerable that have been the most impacted by the COVID-19.
Yeah, I'll just provide one remark, and that is the CDC has come out with recent guidelines regarding mask wearing, and they say and strongly recommend that, especially for indoor public settings, like grocery stores, like restaurants, pharmacies, that we all should be universally covering our faces with either a surgical mask, a bandana, a scarf, just any cloth material, something, that this is a solid strategy for reducing the transmission of COVID-19. Dr. Bickle, would like to turn to you first, if you don't mind. I know you've researched this greatly, so please chime in about mask wearing. And Dr. De Janeiro, I know you want to talk about it as well. So, Steve, please.
Yeah, well, in the last 2 months, can you hear me okay? In the last 2 months, I've kind of transitioned from a mask sort of skeptic, because it's really the wearer of the mask spreading it that is, the mask prevents more than protecting the person using it, but to a fanatic mask, proponent. But here are the reasons. If you look at the countries that have been, highly successful combating this, mostly in Asia, they've adopted near universal mask wearing. I don't think that's an accident. Secondly, as we look to open up the community, which we know is necessary, there's clearly a risk of this thing surging. So, at least expanding to some degree. So we want to pick the least intrusive measures that we can adopt to prevent the spread, and mask wearing is very high on the list. There are models that have been constructed showing that if 60% of the people wear masks at any one moment, and the masks are 60% effective, that alone is enough to get the R0, which is the sort of the spread coefficient, down to 1, which is basically at that point the spread stops multiplying. It just sort of stays level. And then you throw in any other measures and it's additive. So it just seems to me it's kind of a slam dunk, policy to adopt, or, if you can't force it on people, I understand that. We we have our interest in our civil liberties, but in terms of just promoting it and people realizing they're doing this to support their community, to protect their fellow residents, I think it's just something that we should embrace as a highly effective, minimally intrusive way to really keep this thing under control, and additive to all the other measures that we're going to adopt.
Yeah, this is Vince DiGennaro. I agree with Steve, and I think the mask thing. I understand the civil liberties point of view with it for sure. I think we sacrifice a lot of our civil liberties in many different ways, from the airlines, and I fly all the time, and I hate having to bring small tubes of toothpaste because they're just insufficient. But I sacrifice that. To the fact that we get vaccinated, to the fact that we wear seatbelts, you're not allowed to drunk drive. There's a lot of things that would impinge on your quote unquote civil liberties in the name of public health. So I think there's plenty of legal precedent for it. I don't think it's a slippery slope at all. And more importantly, I do think it has a large impact, like Steve was saying, on the transmission. You're not wearing the mask for yourself. You're wearing the mask for the people around you. And I just got off, I took 3 planes and 2 trains in the last week, and I feel very confident that I don't have anything, because not only was I wearing a mask, but every other single person was wearing a mask. So, really is going to drop the transmission rate. And most importantly, if we could come out of our holes, go back to work and restart the economy, and the only sacrifice we had to make was wear a mask and wash our hands, isn't that a trade-off you would make? And I would urge, if the county actually has this authority, to mandate masks in public settings where there's going to be more than 2 people, being a store and other things, because it's not right that someone who is vulnerable has to risk their life to go shopping because someone else wants to be defiant. And you could issue tickets just like you do with seatbelts. I think like I said, there's plenty of legal precedent for this. And I think if we're going to reopen up, we have to have some form of that.
Thank you both for your comments. Again, really, really critical as we begin this reopening phase that we really have to be mindful of every precautionary measure that's available to us, that we are offering that to our residents as part of the solution to help keep everyone safe. So I'm going to pivot now to our city manager because there are some questions about this reopening, right? And the city took the approach very early on to request that our residents stay home. Our stay home order was one that we took very seriously. And as I mentioned, the community has been extraordinarily patient. They've been very generous and very kind throughout this. And I see this as a continuation of what we're doing. However, we have taken the precautions necessary to open up safely our recreational amenities, keeping into consideration the CDC guidelines and recommendations and those other safety measures. So Matt, if you can give, again, there's probably 4 or 5 questions in regards to different types of amenities, where we're going, but just the overall approach, where we are today with our amenities and sort of how that aligns with the reopening strategies that the governor has now ordered.
Absolutely. Thank you, Mayor. So our approach has always been one of consistency with the CDC guidelines, with Department of Health recommendations, and consistency with the governor's orders. As we've talked about at length at several of these meetings, now we have a phased reopening plan the city has adopted and has been working on and refining literally almost daily. So as far as city facilities go, as everyone knows, last week we reopened the open space parks and trails, places where you can socially distance, places where you can get fresh air, amenities that didn't need enhanced cleaning regimens. As the chief said many times in these conversations, the first context that we look at this is we all jumped into a room together in a matter of a couple of days or a week when this happened, and we all changed our life and the way we do things very quickly. And as we've also mentioned candidly on these calls, we spent a lot of time redeploying resources Some of our code enforcement officers became park hosts. Some of our summer help became sanitation experts and, facilities maintenance experts. And some of our permitting staff helped with our increase in call volume and just providing alternative services so there was no service disruption to our community. So now as we watch and we carefully measure the reopening criteria, part of it is making sure in our own guidance that we have enough PPE, enough cleaning materials, enough trained staff, which we're doing right now, on what opening looks like. What does that look like? How do we deploy our resources now, again, to still meet the current needs, still manage, frankly, in the middle of a global pandemic, whereas we were talking before this started, the real game changer at the end of this is going to be, is there a defined course of treatment, which currently there is not, or is there a vaccine, which currently there is not? So keeping those things in perspective, facilities have and will continue to open very, very cautiously, very methodically. This Monday, the 18th, everyone hopefully has seen the news release and the information go out. The Palm Harbor Golf Course will open. The Palm Coast Tennis Facility will open. And the pickleball nets will be put back up at Ralph Carter and Holland Park. Why those first? Those are activities, again, outdoors, fresh air. It's not like basketball. I'm getting that question about why can't we, establish the basketball courts back up? Basketball's a team sport by nature, and the same reason we're having difficulty trying to get our heads around opening up limited summer camp is typically with children, there's no social distancing. They don't know what social distancing means. When the kids are little, hug everybody, put your hands on everything. And we do feel a responsibility. We're not trying to be nannies. I've had that question asked, but we are going to be smart and do things that keep our residents safe, that honor that integrity of this phased opening. To that end, we've deployed those aeroclave machines. We purchased 3 very early on, just as the first hints of this pandemic was coming. We've been using it to sanitize facilities. We've been using it to sanitize buildings. So excited again. What is the golf course going to look like? It's going to be golf. It's beautiful. We've been maintaining the facility, as I said. It's gorgeous. There'll be staggered starts. We won't have shotgun starts anymore with a bunch of people. We're going to limit you to 1 person to a cart. We're going to have portions of the building closed that we feel would get too much traffic or force people to not be able to social distance. But it will be functional, and our staff is literally training right now. In fact, the chief and I and Captain Asconi and some others have a walkthrough tomorrow to assess the plans and the policies and make sure we're going to be successful come Monday morning. Same thing's happening at the tennis center. We have a walkthrough scheduled this week, making sure that little practice changes that are going to help us, promulgate and walk the guidance that we believe in. So you won't enter through the traditional entrance of the tennis center anymore. The side gate will be open. Why? Because it's a huge, wide open space. We're asking people to follow some simple practices. We'll have materials available, cleaning materials. We'll have signs to remind people, things to do. So we will have continued limited opens, but again, we're going to monitor. We're in this guarded optimism phase, and we heard today those 3 key essentials, beautifully stated by Dr. DeGennaro, are not going to change. Wash our hands, please wear a mask, and social distance. And we have such a massive amount of control over 3 simple things that we don't have to give up civil liberties. We can continue to enjoy our quality of life. And so we're going to continue to take that guarded approach, Mayor, again, not out of fear, but with best information we have, with science, with guidance of health officials, with the governor's orders. Of course, on Monday, the governor allowed barbershops, cosmetology, and specialty salons, coincidentally enough, with the requirement that those staffs wear a mask. It is an actual mandatory requirement from the state DPPR and the governor's office. So we're going to continue to follow the guidance, and as we feel we can meet that guidance and, again, respect our citizens and our community and do this appropriately, we will continue to open facilities and buildings.
So I know a lot of the discussion around sort of, again, the governor's phased approach about groups of less than 10 are still going to continue in this phase. And I think that goes to the fact that Matt was speaking about different recreational facilities that we have that do attract large amounts of groups in a very contained area that would not offer or allow social distancing to take place. But we are asking those that are utilizing these facilities, again, if you're not, feeling well, please remain at home, right? If you're at risk, remain at home as much as possible, but you do have to go shopping. You do have to have those things. We're asking anyone that does have any specific questions about shopping opportunities. I know there are a lot of Instacart for local delivery services that our residents are able to utilize. But if you need help, please always let us know. We want our most at risk to be able to be safe and comfortable going out. And so if it is a face mask, we're more than willing to help get you a face mask if that's needed or required. If it is, I need to go get testing, there's a lot of information out there to guide you to that process. So if you are on our bike trail or you are going for a walk, I wear a mask everywhere I go. I very rarely take it off. I do consider it part of my responsibility. I'm not displaying any symptoms. I'm not, anything like that. But however, it is very serious.
If I can mention that, Mayor, currently, as you know, through the efforts you led, we have approximately 1,200 masks at City Hall. These are not disposable. These are reusable masks. Mine's disposable today. But, and to your point, if citizens would like to go on and create a case and ask through Palm Coast Connect, helps us track and understand need and, where they're going. And we'd be happy. I think we can definitely facilitate masks at this point, and especially since we would like every citizen to wear a mask.
Yeah, and that's what we're requesting for obvious reasons today. And then there is another question I think is important, Chief, if you would just respond to, and then I'll ask for sort of those closing comments again. And it really has to do with hurricane season. Hurricane season is upon us. We read that the state emergency management team is addressing some evacuation concerns, some sheltering in place if you're sheltered at one of our schools during that time process. That phase, what does that look like for social distancing? What does it look like for those that fear that exposure, are at risk, those sorts of things. And I'm certain that your team is concurrently working on an initiative and a plan as well that would take into account the complexity of what we're facing.
Yes, today on the conference call with Jonathan Lord, our county emergency manager, he's already starting the process of how do you evacuate people, especially those who need special needs or special attentions. How do you get all these people to go to a cafeteria and maintain isolation and social distancing? I believe he's going to start with getting information from other states and feed that information down the line on how many square feet you're going to need between groups of people. The department has been ramping up for wildfire season. Every time we get near the 400 mark, it comes back down to about 350. We're still monitoring conditions on that. Last week they had a fire in Escambia County that was pretty horrific, and it tore up a lot of acreage. And that was a drought index which was better than ours. They had less fire conditions, but it was a wind-driven fire. So we're keeping an eye on that. We're gearing up to what we do in the summer months. Usually you don't see many types of hurricanes or storms early in the season. We've got a depression that's forming off the Bahama coast, and it's expected to move up towards Bermuda. It's the warning for what's coming. There's projected to be a very active season. We will do what we do best and monitor and prepare and get the information out on what people need to do. But as far as individual responsibility, and you spoke earlier, now is the time to find where in the state that you might have family or other people that you can go out of harm's way so that you don't get put into social distancing challenges if you have to go to an evacuation zone. Anything on the barrier island or in zones B, C, or D on the east side of 95 in Palm Coast, you may have to evacuate if we were going to get an indirect or a direct hit. You have to secure your location before the storm comes, and those are the plans that you should start doing now. I think everybody has seen pictures of folks that are isolated in a facility that has got a lot of people in it. For my own planning, my own family protecting, we make sure that there's people in other parts of the state or the country that they will load up and go to, that they have a destination to go to. And I understand not a lot of folks have that ability, but if there's a place that you can go that you can avoid having to be put into those circumstances, and you're concerned about your age or your previous medical condition. Start planning that today.
You know, just another thing on the plate of emergency
One more thing.
management. Well, we appreciate your service and your continued effort to ensure our residents' safety. So please make sure you continue to thank our first responders
Thank
on
you,
our
Mayor.
behalf. It's critical that we keep them safe, and our residents can do that by staying informed and up to date with current information. That's why we host these virtual town hall meetings weekly. Again, this is for information for our residents, so please continue to submit your questions. As I indicated, these questions will be responded to in writing following our town hall meeting, so it's of great benefit for our residents to really understand what's driving some of this discussion point that you're hearing about today. And so we are out of time. I normally ask for sort of closing comments from each of our guests, but I think what I'll do today is really thank our guests, frankly. This has provided such a wealth of diverse question and answering that I really want to take each and thank each and every one of you for the time that you've allotted for our residents to truly understand. Thank you for being part of the solution. Thank you for your efforts for understanding what's going on with COVID and tracking it as we move forward. So to our residents, thank you for continuing to be part of great practices that we have asked you to do. So please wear your masks at all times. And again, if you don't have a mask, we'll be sure to get you a mask. If you have any questions about shopping opportunities and the safety and welfare of what you're experiencing, we want to help you with that as well. Continue washing your hands. That's critical as we move forward with this. Continue the social distancing. That is critical as we move forward with this. And again, please wear the masks as a great community member for each and every one of our residents that is looking to each other during these times of uncertainty. So thanks again for tuning in. Stay safe, everyone. We'll all get through this together.